Welcome to Savida Dental College lecture cast in periodontics. Today's topic is on alveolar bone loss, and we discuss about mechanism of bone destruction, factors influencing bone destruction, rate of bone destruction, and pattern of bone destruction. Mechanism of bone destruction, we know that it is from the spread of gingival inflammation to the bone, which result in the osteoclast activation and other inflammatory mediators which result in bone destruction. If you want to understand the spread of inflammation, we should know the blood supply of the gingiva. We know that gingiva get its blood supply directly from the alveolar bone or from the periodontal ligament space or from the periosteum. So the inflammation spread along the path of the blood vessels through the loose connective tissue around the blood vessels. So interproximally you can see that mainly the inflammation spread directly to the bone, or it can towards the periodontal ligament space or towards the periosteum. On the buccal and lingual side, mostly towards the periosteum and towards the periodontal ligament space. The osteoclast are the major cell which is responsible for bone resorption, and it is originated from the hematopoietic system, that is monocytes are getting converted to osteoclast under the influence of colony stimulating factor, and the pre-osteoclast fuse together to form the matured osteoclast. So during for the activation of the pre-osteoclast, a receptor which is responsible for that is RANG, that is a receptor activator for nuclear factor kappa, and the ligand is RANGL, and that is secreted from the inflammatory cell as well as from the osteoblast, and thus the osteoclast is formed. And the osteoclast morphology, if you look, all of you know that it has a ruffle border, and on either side there is a sealing zone. It is a multinucleated cell, and the osteoclasts resorb the bone by two mechanisms. First mechanism is removal of the mineral content, followed by the destruction of the organic content. So mineral content is removed by the acid, that is hydrogen pump secreted by the osteoclast, and that create an acidic environment which remove the mineral. And the organic content is destroyed or removed by the acid phosphatases or cathepsin enzymes produced by the osteoclast. And along with this, other factors which are involved in the bone resorption are the inflammatory mediators such as interleukin 1 and 6, tumor necrosis factor, and prostaglandin. The factors influencing bone destruction, we have local as well as systemic factors. Under local factors, the important factors are occlusal trauma, which can aggravate the bone destruction or alter the pattern of bone destruction. Then the anatomic variation can also alter the pattern of bone destruction, and food impaction is another factor which can cause bone loss, mostly in the interproximal area. The systemic factors, the important factors are osteoporosis and hyperparathyroidism. Both will result in osteoporotic bone, so that makes the bone vulnerable for increased destruction. And the rate of bone destruction, again, it varies according to the type of disease and also according to the location. Type of disease, mostly we can see that aggressive periodontitis have more amount of rate of bone destruction will be faster, and the interproximal area will have more destruction than the buccal or lingual side. And pattern of bone destruction, there are two patterns, that is horizontal or vertical. In horizontal, the crest of the bone will be perpendicular to the angular long axis of the tooth, whereas in vertical bone loss, it is at an angle to the long axis of the tooth. And factors influencing the pattern of bone destruction, the major factor is trauma from occlusion, that is which changes the spread of inflammation directly to the periodontal ligament space. That will result in the bone resorption from the inner side of the periodontal ligament side of the alveolar bone, which result in a vertical type of bone destruction. The second factor is the thickness of the bone. That can be explained by the radius of action concept. That is, bone resorbing agent can act around a radius of 1.5 to 2.5 millimeter. That means a thicker bone, that is more than the radius, will result in a vertical bone loss, whereas a thinner bone will result in a horizontal bone loss. And thank you.